It's my pleasure to introduce today's speaker, Dr. Julie Wei. Dr. Julie Wei is an internationally recognized award-winning speaker, and she's author of a number of books, including the book I recommend highly called The Healthier Way. She's Surgeon-in-Chief. She's Division Chief of Pediatric Otolaryngology and Audiology at Nemours Children's Hospital in Orlando, Florida. She's also Professor of Otolaryngology, Head and Neck Surgery, University of Central Florida College of Medicine, and really well-respected and an amazing surgeon. Without further ado, I will leave the floor to Dr. Wei, and we are looking forward to hearing her presentation entitled From Burnout to Well-Being. Dr. Wei, thank you.
Thank you, Dr. Daniels. Hello, everyone, to my colleagues that I haven't met, but I am just honored and delighted to have a chance to speak all of you today on a topic that is a passion and commitment of mine born out of my personal journey, which I will share with you. So today, I am just excited to talk about this. The last few years, we heard a lot about this topic. It doesn't matter what country, what language, what ethnicity. It is impacting physicians and all others in healthcare. So again, thank you for the opportunity. I hope by the end of our time today, I can help contribute to your awareness and understanding of the causes, both external and internal, that lead to burnout, and the fact that it's a spectrum. Also, I will be describing some approaches to reduce the risk, and also often what we're not hearing enough about is we hear about the problem, but understanding some strategies that are based on the individual as well as organizationally that will increase our individual and then, collectively as a group, our own well-being or wellness. So first, let me say that I have close friends in Canada, have enjoyed colleagues, incredible people like Dr. Daniels I've known him over 20 years. I've been to several various regions in Canada, just spectacular. And please note that I plan to vote for you for my next president. Personal well-being is really shaped by a sense of purpose and balance. I have had a chance to write a couple editorials on the topic of balance, but I didn't always focus on this despite spending years training to become a physician and a surgeon. I put the slide up to remind myself and any audience I speak to so that I'm very clear what is my life and my sense of purpose every single day. I know every one of you on this call who can see the slide. You have a slide for yourself made up of pictures of different things and different people. So for me, my partners are on here, medical students, people that we train, the operating room staff, my clinic staff, and you see my beautiful family, my husband Dave and my daughter Claire, who's 13, and I'm the one on the right. My patients, I will share, I lost significant joy in my daily practice of medicine. That was almost a decade ago. I didn't know it was burnout. After recognizing it, being committed to experiencing my life different, I'm grateful that not a single day goes by where I'm not aware and remind myself and have empower myself to reclaim the joy that is mine. The bottom picture is my family as well. Just very briefly, because it's important, I love for you to know us. I work at Nemours. I've been here 6 years. We're a health system. So I am in Orlando, Florida, but we are across many states and impact millions of lives for children. If you ever get a chance to come visit me, specifically, I'm 10 minutes from the Orlando airport. This area is relatively new this decade. I am in the Children's Hospital. Our medical school is only 10 years old. The largest veterans hospital is here, as well as now the United States Tennis Association headquarters. So it's been a blessing to be outdoors. What's really important for me when I speak and share my journey and awareness is the fact that burnout is not dichotomous. You don't have it or don't have it. In fact, it's a spectrum. So there's three main subscales to be aware of that academically defines the burnout syndrome, first described by Dr. Christina Maslach, a PhD from Berkeley, California, as early as 3 decades ago. So emotional exhaustion, when you feel like you have nothing left to give. When you get to that point, you're kind of in survival instinct. People tend to become more there's increased cynicism. You start to have some depersonalization. It's hard to have empathy and be emotionally available for your patients when you're at this point yourself. And if you have both emotional exhaustion and start to have depersonalization, then often that leads to a sense of reduced personal accomplishment. Also reduces your effectiveness. No doubt, as a human being, you are not at your best self and cannot bring that to work and to your colleagues or at home. So once again, you are at low, moderate, or high degree. Everybody is at risk. Well, what does it really feel like and look like to not just you, the physician and provider, but maybe to your colleagues? On the right-hand side here are some symptoms. If we were together in a live audience, I would ask you to raise your hand. Do you feel tired all the time? This is the words that we physicians speak to each other. I hear that all the time in the hospital and clinic setting. Are you having insomnia, difficulty, feeling aches and pains? Are you worried? You've become highly anxious. You have some anger issues, perhaps. Maybe suffer and experience some depression of a variety degree of severity. So on the granular level for the individual, that's what that feels like. This is an article that came out last year that was very well written from physicians out of Harvard, Brigham Women and Children. The title was Physicians Aren't Burning Out, They're Suffering from Moral Injury. I encourage you to Google and find this article and read it. What is very meaningful, and I agree with the perspective, I think we are burned out, but the moral injury is talking about the fact that the pressures put on us in the complex healthcare systems, where the focus is so often on volume and productivity, is oftentimes can go against what we went to medical school for, and in our personal values and ideals of what that relationship and experience should be between physicians and patients. As a surgeon and a subspecialist, I know that for me, it is a routine to see a patient in 15 minutes. Imagine if you brought your child to see me. I have to first understand, listen to you, do a great exam, talk to you about what I would do if this was my child. And then if as a surgeon, I recommend surgery, it is critical to me as a mother first and a surgeon second that I go over the risks and we answer all your questions. So now put all that in 15 minutes in a way that doesn't make the patient feel rushed. You can imagine day after day, this can become quite emotionally exhausting. So I have to share that I am very impressed in preparation for the honor of speaking to you, and thanks to the organizers, I had a chance to read about what has been done and what the data is in Canada for physicians compared to the United States. This is out of the Canadian Medical Association with the report last fall that maybe as high as 1 in 4 Canadian physicians are reporting burnout. In the States, most of the data, that you may read on Medscape, it may quote up as high as 50%. Now, this slide, I highlight 4 things, and this is directly from the article, right? They report that up to, 82% of physicians and residents, they self-report high resilience, but 1 in 4 report high levels of burnout. 1 in 3 screen positive for depression. This is very much in line with the other literature that's available, that up to, in the surgeon literature, for example, the data we have shows up to a third or a little bit more screen positive for depression. Now, what is also similar is that there is a difference in gender. So please know that the data that's been published, all are consistent. Women tend to experience more emotional exhaustion than men. In the reports for Canadian data, women, when compared to men, there's 23% higher rate or risk of burnout and 32% higher when it comes to depression. Canadian colleagues, all of you, and especially the incredible organization you have in Quebec, such as your Fédération, you have services that, in my perception, seems to be further ahead of what's happening here in the United States. However, this article shared that despite 81% being aware of the services, yet only 15% access them in the last 5 years. And I think that the reason or hesitancy is not different in Canada compared to the United States. Typically, for physicians, we're high-functioning individuals who feel a sense of shame, reluctant to seek help, or denial is very strong coping mechanism. We don't think we're sick enough to need help. In the United States, I can tell you that the reluctance is because once you report it, everyone's afraid it goes on your record. So when it comes to renewing your license or implications or trying to get credentialed at new places, people are worried that may be an issue. I also want to make sure all of you are aware that there was a report published a few years ago, the Quebec Physician Health Program. I had a chance to browse through this document. It's very informative. I'm sure the organizers of this call can make that available to all of you if you don't already have it. I won't spend too much time except to share that in preparation, when I looked at the data or what's available for Canadian residents and faculty on the topic of burnout, you will find that what's been published generally is limited as far as number of people. Nonetheless, it's interesting. This study from ENT Journal in 2017 actually looked at just ENT residents, and the numbers aren't very high. What they looked at is whether having a formal mentorship for residents would help them. A variety of surveys were used to measure quality of life and burnout. And what they showed after a year of formal mentorship, those who were mentored definitely seemed to have improved in their scores for psychological, physical health, social relationship, and even for the overall environment. So I don't think this surprises any of us that all the more reason to be well ourselves, because those we are training depend on us. Now, U.S. and Canadian medical students, very high risk of depression, anxiety, burnout, and even suicide. So this is a study, this is now over a decade old. However, when they reviewed the literature and found 40 articles about it, back then, there were no articles on burnout. That has changed, but very high prevalence of depression and anxiety. Here in our hospital, I just hosted a physician suicide film. I can tell you that this is really tragic that we pick the young, brightest people who do incredibly well. They enter medical school and the profession with such optimism and belief that they can help, and yet something happens in that competitive environment, the exhaustion of studying, being away perhaps from family and support system, and basically the fact that ultimately there are young people today committing suicide is a tragedy that's absolutely not acceptable and that we are all committed to changing. Now, this study out of Toronto looked at relationships and effect on resident wellness. Again, it was only 16 residents, but they looked at different specialties. The residents perceived the relationships outside of work are influenced as their professional identity evolves. I think for me, basically, I would say that when I reflect on this, all of us, being a doctor is more than a job, right? So our identity becomes synonymous with being a physician, the expectation to heal all others. So this study, the residents said they had to adapt their relationship, Many of us know when we go home to our spouses, I don't know if it's the same for Canadian spouses, especially if they're not physicians. I am often reminded that I am not your patient, or more, I don't work for you. So sometimes I very much, all the time perhaps, have to watch my tone and my communication, because without intending to do it, I could speak to my own family member in a way that may come across much less kind than it needs to be in a very stressful, chaotic work setting. Not that I come to work bossing people around. That's not what I'm trying to imply. The bottom line is the coping mechanism to manage conflicts that arise from personal relationships, that is what's lacking and is very challenged. And I don't know about your system. I was never trained medically, surgically, to even know how to work on those aspects of my being, especially on how to take care of myself and my relationship, my marriage, all of which have been challenged. Finally, a couple other studies. This one says a fifth of Canadian psychiatry residents are burned out. No doubt if that translates into psychiatrists themselves. As it is, we don't have enough physicians who can take care of physicians. So certainly something to pay attention to. Cost data is very fascinating to me. I didn't find much except this one. The fact is, if physicians are burned out, and we know many are leaving their career, many feel they don't have a choice. Others are retiring earlier than they are. In the United States, we have an explosion of baby boomers in the next foreseeable decade. There will be significant increase in gap for the number of people that require care and not enough physicians. So I think this is my last data point for Canadian literature. Basically, many were surveyed, and there's 2,500 or so responses. And this paper looks at demand, value, and level of burnout. And essentially, no question that workload directly can impact or predict increased exhaustion, cynicism, and burnout. But values congruence, essentially, I interpret this as, if your ability professionally to be your best, to be effective, efficacious, really, ideally, we want, whether it's our workplace, work environment, the organization we work for, the hospital we work for, hopefully when the values are aligned, I am not wasting energy being angry, bitter, negative, that I can be more effective when it comes to impacting the patients that I take care of. But this paper said overall levels of burnout indicators was only modestly different from normal levels. But I'd be curious when you all read this article, what you feel is relevant to your experience. So now I'm going to talk a little bit about the factors. I don't think this will surprise anyone. I know our healthcare systems are different, but here in the United States, despite trying to meet the pressure for each of us to see more patients in the same amount of time or less, there's decreased reimbursement. So the only way at this time when we're reimbursed by volume, that continues to drive burnout. The metrics set for physicians continue to increase. This includes whether it's your salary or your bonus. And I can speak for myself that I'm very blessed to have the opportunity to be a physician leader. But the fact is, I've been learning in my roles as division chief, surgeon in chief, whatever leadership role, we're expected, right, to also be the one to provide solutions to solve complex problems, everything related to the delivery of care, patient access, all kinds of things that I was never taught at. Patient satisfaction score is something that's highly utilized here now. More and more hospitals are using them. It's almost like you are a physician who's just like if you review a restaurant on Yelp. I'm not sure if you, my Canadian colleagues, are facing that pressure. I've already talked about not having enough time for anything. We allow access for patients to call, email. My Epic inbox is huge of things that require my reply. So many physicians, when they're out of work, go home, are still on the computer. And my editorials and writings usually talk about the fact that there's not enough life. How can there be when I already work 12-hour days, and when I go home, I cannot sacrifice sleep if I want to be effective? Then the amount of time left for my loved ones and for myself is quite disproportionately less than it should be. So this is an example. That's what I looked like when I was younger. So if you Google me and I look different now, try not to judge. But this is when you Google our system, you can see where it says patient satisfaction. And so nowadays, when I ask families, how did you find me? It should not surprise you. It certainly doesn't surprise me. They're finding doctors based on the reviews that are posted on the internet. For my organization, we have reviews available to the public for every physician. So back to, for each of us, what is our daily reality? This slide highlights the emotional spectrum that we all have. On the left-hand side, these words evoke calm, all positive emotions, right? And I try very hard to have awareness that I'm grateful for my life and every breath that I take and not take that for granted. On the right-hand side, I'm the same person who, depending on the situation, if I'm bombarded by calls, pages, everybody coming to me wanting my attention, and needing me to quote-unquote solve a problem all at the same time, I get overwhelmed. When I go home, I'm still a spouse, a mom, a neighbor, a friend. There just seems to be endless amount of things that I need to do or have committed to professionally in the name of trying to do good. So oftentimes, if we're not careful, you have to recognize when you are spending or living in a lot of the emotions on the right-hand side. You have to be able to recognize it and do whatever it takes to get yourself feeling more on the left-hand side. A little bit about depression and suicide. As I mentioned already, up to a third of students and residents screen positive. But turns out physicians and being in medicine, physicians in general, we unfortunately have data supporting that it's the highest occupational suicide risk. Not only that, perhaps because of our education and understanding of human anatomy and physiology, we also have the highest completion rate. Tate Shanafelt is very well known in the United States. He was at Mayo. He's now at Stanford. This is now many years old, but when he surveyed surgeons, 1 in 16 report suicide ideation the past year. Only about a quarter sought psychiatric help. So again, if we were in a live audience and I asked you to raise your hand, how many of you know somebody or a colleague who has died by suicide? I would be interested in what my Canadian colleagues how many would raise their hand. I need to tell you that I've been speaking publicly, traveling the United States, and when I ask this question, it breaks my heart that over 50%, sometimes as high as 70% of the audience will raise their hand. And it is just sheer silence when we look around the room at each other and the number of hands that are raised. So my takeaway message to myself and anyone I speak to is the sentence on the right-hand side. The fact that doctors are human, that's not how we are raised. That's actually not what I believe about myself deep down. The years of almost taking pride in, as a surgeon, I don't need to eat. I don't need to even go to the bathroom because I'm dehydrated most of the time. I don't really need sleep, do I? I can work past this. I can push myself. I don't need to call in sick. We don't do that. The fact is, all those are false stories in my head. And until we individually embrace and accept the fact that we too are human, we too are susceptible to illness, mental health challenges, addictive behavior. If we don't accept that and help each other see us for who we are, I think change will be too slow in coming. So I will not play a video, but I will show, if you don't know who Dr. Pamela Weibull is, she's very well known in the United States. as somebody who champions and brought visibility to the topic of suicide. Please Google her. You can read. She has kept track of every physician suicide she knows about and calling the families and learning about them so she can share with the rest of us why physicians commit suicide. Oftentimes, this is probably not just physicians, but anyone who takes their own life. It's not that you really want to die. You just want to end your pain and suffering. Also, it's a public health crisis. 1 million Americans lose their doctors to suicide every year. And I didn't know this till I learned family members of doctors who commit suicide are also at high risk. Here in the United States, I can personally tell you that as of 2 years ago, I had to settle a lawsuit. This was over a child whose ear tube came out and there was a small hole in the eardrum. The lawsuit was filed 8 years after it happened. It took me 2 years, significant personal pain and anger and frustration to get through this lawsuit. So this can be devastating for physicians. I already mentioned that doctors fear that when they seek help, it's not confidential. And what should not shock us, but it is sad, is non-medical people, our own patients and families and society, they are shocked to find out we have the same mental health issues and personal problems that everyone else has, because they too don't think we're human. This slide just shows that anesthesiologists and surgeons have the highest rate of suicide, more anesthesia than surgeons in the U.S., but that's because overall there's more anesthesiologists than surgeons. However, by percentage-wise, surgeons are at significant risk. I mentioned earlier, I hope that if you haven't heard or seen it already, there's a documentary called Do No Harm. Robin Simon is an amazing director. We just hosted this event here. We had 120 doctors, providers come, and my hospital leadership, and I moderated a panel with psychologists and our residency program director so that we can open the conversation, talk about mental health needs that are not met. So here's my journey in a pictorial. I finished training. I did residency at Mayo Clinic for 5 years as an ENT surgeon. Then during my fellowship, 2 years of it, I finished in 2003. I moved to Kansas City, was a faculty at the university, and worked at a children's hospital there for 10 years before I moved to Orlando. When I finished training, I'm an immigrant from Taipei, Taiwan, came here when I was 10. You can say I won the lottery. I'm personally affected. My mother died of breast cancer when I was 9. My early childhood memories were that of a huge university hospital. Back then, there was no outpatient chemo. You wouldn't be surprised to hear, by losing a parent at a young age, my father remarried, we immigrated, I learned the language, we started out with nothing, very traumatic. I suffer from depression from early teenage years, and that has affected me on and off throughout my life and my career. The great news is now at 49, much more aware and at a much better place in my life. But basically, out of training, I just immediately worked very hard, building a practice, trying to be a good teacher, good surgeon. I was married. I'm 5 years older than my husband. I started trying to have a family very late in life. I experienced infertility. You know, fertility is one that affects so many women and women professionals now. Back then, you don't talk as much about it, but this was the one thing that was very emotionally exhausting. I'm blessed. My daughter Claire is a miracle pregnancy, but during that time, I remember as I was promoting early, publishing papers, trying to be a quote-unquote rock star, what I really was exhausted. Even after having pregnancy, having a baby, you think that now everything is great. I have everything I want and need, a beautiful house. I make a good salary. I am known in my town, have a good reputation. But what other people didn't know is on the inside, 2009, 2010, I started waking up with bodily aches. I didn't want to go to work. I felt my life had no future because my patients are booked out 3 months. I just did not know what happened. It's like I was completely lost. I would go to work and get angry. I feel everybody was unreasonable, demanded too much from me. I didn't feel joy when I'm taking care of children and their families. I didn't know until the year after when I was interviewing, thinking that I must be at the wrong job. I actually traveled on airplanes, sat still, reflected, wrote in journals, and went to a conference to figure out what was wrong with me. And that's when I recognized the high degree of burnout and made a decision that instead of indulging in these rare thoughts of suicide, that I would commit the rest of my life to living the gift that I've been giving. So I can tell you what I didn't do well for a long time. I almost never exercised. I played tennis in high school. I have a black belt in Taekwondo. But once you become a doctor, it's like nothing else is important. I rarely ate breakfast or lunch. I didn't drink well. I went to my OB-GYN, but never go to the doctor. Why would I? I sometimes thought I didn't even trust most doctors. All they do is give you a prescription. I really didn't rest. What I did well is I have to admit my husband and I went through counseling, not because we ever thought we would get divorced, but because I knew that we weren't at our best and I needed help. I did get dental care. I am food obsessed. You can Google me. I cook at home. I have a website. I love that. And I love my family through controlling our health through a diet. I love people. I usually prioritize sleep. I don't smoke. I drink alcohol, not that much, and I never touch soda. I did plan vacations like my life depends on it. I started over the years to really recognize vacations, and almost all of them involve significant immersion in nature, because over the years, that's what really restores me. So in Kansas, after my burnout, I realized other people are experiencing this as well, and I support men just as much as women, but I launch women in medicine and science, and I'm proud to say that would be my legacy, was getting everyone together to have awareness and feel empowered and contribute to each other's success. So the natural recovery, here it shows burnout. You need to be in a hammock. So I moved to Florida, and here I am. So there I am with my daughter. She's 13 now. We here in the United States love Halloween. You can see me there on the paddle board. I really try to get out there. Over the last few years, my message is really about awareness, accountability, and action. I would ask all of you today, who is really responsible for your self-care and well-being? Because it is not your organization or hospital system or your government or whoever your employer is. I've made a commitment that it's me that is responsible, that I alone have to increase my well-being. This is something that deserves to be discussed with your partners, colleagues in your medical schools. It is important, however, that once you start that conversation, hospital systems are responsible for creating programs, responsible for giving you access to mental health resources, having high-quality interactions with colleagues, being flexible when we can when it comes to work. So how do you show up every day? After 2010 and high degree of burnout, this awareness led me to ask myself, and instead of just going through the motion, sometimes I would go home, walk in, and start going on about how bad my day was. Then what little precious time I have with my family, I wasted it reliving my drama and stress for the day. Now, when I pull in the garage, I take a moment to think about what I want that to be like. I try to put on music. My daughter and I love dancing. I think I miss my calling as an actress and dancer, but it just gives me so much joy. I'm big on limiting devices. That is a fight with my husband and daughter, but for myself, taking walks, riding a bike, whatever it takes. I'm trying to do better, to tell people I love that I love them, appreciate my colleagues. Smiling is free, and it's terrific. I am a human touch person. I know that with HR and Me Too age, et cetera, If you ever meet me, I am a hugger. I will likely hug you, so be warned. For me, being grateful is important. Day One is an app that really helps you journal. All the research data shows when we're grateful, people do a lot better, are much more resilient if you focus on gratitude. If you come visit me, I will walk with you. I walk every weekend to see the sunrise whenever possible. That is really my restoration and refills me. So a few slides, I am watching our time today, about energy management. I won't go into detail, but I'm a certified trainer through Johnson & Johnson Human Performance Institute. Americans think that energy comes from Starbucks. That's absolutely not true. I will share with you what I learned is by the time we're 30, our physical capacity declines every decade after that. But the demands of our life increases when we have to take care of aging parents and children, etc. So if we don't do something about our health, that's a problem. Energy is four-dimensional. Please know that to become extraordinary as humans, you need enough quantity, which is physical energy, emotional, mental, and spiritual. So I love this as a surgeon in the operating room, and this is the sinusoidal wave of life. Every day when we come to work, we're expending energy, so you're fully engaged. But you must recover. It's like plugging in your cell phone at night in order for energy to come in. In order to get energy, I teach anyone that's around me, you don't need Starbucks. I mean, I love my coffee in the morning. But in order to get energy, you really just need deep breathing. You need oxygen and you need movement. As long as you start physically moving, you will have increased circulation. And if you take a deep breath, you will naturally get energy that way. The book that I read in the last 6 months that I recommend to you is something called Younger Next Year. It's a bit extreme, but I love the line. We will all age, but we don't have to decay. So exercise is important. I never knew as a woman, I just thought, weight training is for men. Turns out we lose our muscle mass 10% every decade after 30. So now I definitely make sure that weightlifting is something I do, even if it's infrequent. What's really helped me is build an incredible network of support, not just friends, family, colleagues, but a professional network. Recently, in fact, just as of last weekend, I had the pleasure of seeing Dr. Daniels at a national meeting. He did an outstanding job as a program chair. But those are meetings that a couple times a year I look forward to seeing people that I respect and care about, and I can also ask them and talk about issues. My big plea to you, even though I cannot see you today, if you are suffering, if you are having difficulty with relationships, if you believe and have to admit you have a dependence problem, if you feel depressed, if you, God forbid, have any negative thoughts, please ask for help. Please reach out. Here at Nemours, what I'm doing is creating a resident and faculty wellness program. This is ACGME required. I'm very proud, too, to chair a new committee on health and wellness. What's important, what is lacking that I am creating is the fact that our residents and faculty will have 24/7 acute mental health support with a psychologist that they will know. Every resident, and I'll start with the chairs and chiefs, they will spend 1 hour with the psychologist, and then I'm going to start taking physicians to do a 1-day energy management training at Johnson & Johnson Human Performance Institute. For me, doctors are very smart people. We know we need to exercise more, but until we change how we think, our behaviors do not change. So as I mentioned before, I'm a lover of nature. My dog, Shiro, he's the white Samoyed. The middle one is the lake that I live nearby that I kayak in. And for all of you, I'm sure you recognize Moran Lake and Lake Louise, where I had the just absolute gift to spend time at last year. And then the bottom is a sunset picture. Other people collect fancy cars. I simply collect sunrise and sunsets. So if you ever need a photo, I'm happy to send them to you. As I get ready to wrap up, I will share that this is a very special quote that I came across. We need to let go of our shiny doctor self. We need to accept the vulnerability, doubt, and imperfection within, rather than try to obliterate it. We have to find kindness for ourselves, our medical and nursing colleagues, and our patients, because sometimes that's the only thing that makes this path bearable. We need to create this new medical culture that sees humanity as a precondition for being a good doctor, but not an obstacle. Thank you.
Thank you very much, Dr. Wei, for this is coming from the heart, and we can feel it. It's extremely appreciated. Thank you for sharing your personal journey. It's much more meaningful for us to hear from someone who puts their personal journey and shares all this wisdom than somebody just summarizing facts. And we very much appreciate it. Overwhelmingly positive feedback. Tons of great comments of appreciation to your lecture. And maybe a couple of questions. One that has come out a number of times is considering that physicians are shy, ashamed, uncomfortable to express, their distress, or perhaps even to detect their distress. As a colleague of someone who you feel is and as you mentioned, burnout is a spectrum, is in a spectrum of burnout, or you suspect that, how do you approach them? Do you have any tips to approach a colleague who has not come forward, but someone that you care for and you would like them to take care of themselves?
Thank you. I appreciate that question so much. Very relevant. For me, I get energy from people. I think that anytime you observe and watch, and I've learned that oftentimes physicians who are described as disruptive, they're actually hurting on the inside. I would encourage you, if you see this, you watch it, you know it, just pull the person aside, set up time, take them out for coffee, and just simply look them in the eye, give them a strong hug, and say, hey, how are you? Here's, I sense something may not be quite right. Do you want to talk about it? And that's it. Open the door, be available, and you will find oftentimes people hold it in, and as soon as there's an opportunity to let it out, they are grateful. They can't even control it. I bet there may be some tears, and they will share. And then together, hopefully you can encourage them to seek help. I think this is where in Quebec and in your organization, you have resources. It is very important for people to know it, but my experience is I am not going to Google and find a therapist that I don't know to talk about my problems. That's why it's very important, in my opinion, to have somebody you know. So so for me personally, I had a colleague who underwent significant distress with her marriage and challenges, and I helped identify a professional to make it easy for someone, or recommend who you know that you trust. But something just, day to day, I think it's important in order to build that trust for people to open up. You need to establish that trust and relationship every day. So when we ask people, how are you? It's not in the middle of running to a clinic, but really just taking the time to have high quality interaction with your colleagues.
Thank you so much. Je vous rappelle d'envoyer les questions à nos participants. Vous pouvez les envoyer en anglais ou en français. Je vais les traduire. So another question, could you tell us more about the Johnson & Johnson Energy Management Training? We've had a few questions about that. People would like to know more about this program.
Yes, absolutely. So I know Mr. Jim Lair, he's a good friend. 30 years ago, he and another sports psychologist created the Human Performance Institute. Back then, they were looking at what makes somebody an extraordinary athlete and perform top world-class level. Now that it's been acquired by Johnson & Johnson, it is Johnson & Johnson's a very big company. The Human Performance Institute, they are working with no longer just athletes, but Navy SEALs, corporate executives, and they certainly are interested to work with physicians. What they do is in a single day, I spend 2.5 days doing the corporate athlete course. Then I spend 2.5 days becoming trained as a trainer. But now they have a 1-day course that I will take physicians to. And what it is it talks about how you can optimize your energy. How do you optimize physical energy through exercise, healthy eating? How do you optimize your mental, emotional, spiritual energy? It's really defining your sense of purpose in life. That for every individual human to perform at their best, you have to manage your energy in all 4 domains. So perhaps I can certainly share a contact or a link for you to share. For the physicians that I'm bringing, it is $710 per physician with a discount for, that is with the discount. So that's what they charge. It's not cheap, but as a certified trainer, I'm able to then help my own hospital by, regurgitating, right, some of that content. And I try to put some of that in my presentation today.
Thank you very much. One more question. What activities did you find most useful to cut, stop, or delegate in order to find more time for yourself, to exercise and to relate to your family?
Wow, that's a great question. I'm horrible at delegating. I'm still working on it. I'm going to tell you, time, it turns out in physics, we don't run out of time. Humans always say that. I used to say to my daughter, Mommy doesn't have time. You are time. So I'll give you an example. 2 years ago, I stopped being angry because that we never played tennis. I love playing tennis. My husband didn't want to, so I kind of secretly just blamed him. And then 2 years ago, I decided I cannot blame him. If I want to play tennis, I need to go play tennis. I grabbed my bag, a racket, went to the court, didn't know anybody, ran into somebody. Next thing I know, it's now been 2 years. I play every weekend. So you make a decision on what's important to your mental and emotional health. For me, that's every Saturday I try to set up tennis. If I don't set it up by Wednesday, I'm very anxious. That is time that I choose to spend. My husband and daughter, they understand, they support it. After 2 hours of sweating, I'm happy. They're happy. I end up being able to spend my weekend in a more positive way. What do I stop doing? I think it's individual based. You have to really decide, when are you at your best? Do you do your emails at 5 to 6 in the morning? Do you say, I'm not doing the email? I'm not going to give up 2 hours at night. You get caught up in things that take up your time. I plan my non-work time very intentionally. I can tell you that on weekends, I used to think, okay, I'm not at work. I would bark at my husband and daughter, let's have quality time. That's not how they work. We have to talk collectively about how much homework, work, what are we going to do? We cut out too many birthday parties and play dates with other children. My daughter understands that because I work so much that on the weekends we protect the family first. So hopefully that explains it. You just have, I let some things go, but I'm a little compulsive. I spend 3 hours cooking every Sunday so that Monday and Tuesday when I get home, I'm not cooking then. So everything comes, with it's choices. You just got to be intentional about the choices you make.
Thank you very much. Another comment. Very appreciated presentation. You are changing my life, which is very nice of one of the persons here. And what they ask is, what do you do with a very charged schedule? What do you do with a persistent feeling of lack of time and that this pressure inside you of lack of time?
Thank you for the feedback. I love that question. I now still see patients every 15 minutes, but we rob and steal, right? If it's a post-surgery, some patients don't take us long. I do so much diet counseling because I'm passionate about changing children's health through diet. So sometimes some visits take 25 minutes if they have a trach and a G-tube and everything is wrong with the child. what do I do is what has changed for me is to be in the moment. I would encourage whoever is reaching out to me, and by the way, you can email me personally. I want you, the next time you go into the patient encounter, to never look at the clock. I never look at the clock. I don't. I mean, my staff will tell me if I'm running really behind. I immerse myself. I shake hands. I touch. I have learned to rediscover joy through having that person be everything to me in that moment. I laugh, I smile, I tell jokes, I hug my children, my patients. That fills me up. So instead of thinking about not having enough time, oh my God, I got to see 25 patients today, and then I got to dictate, I'm not thinking about that. My mind is entirely consumed with the human interaction. So for me, that's what I do. As a division chief, I am empowered to help each of my faculty, be flexible where they need to be, respect the differences in different parts of their career. I think that you need to look at your day-to-day, be very clear, and control what you can. If you don't want to, if you can start at 8, but on this day you need to leave, whatever your schedule looks like, you got to not just think that's not changeable. Talk to your chief, your chair, your hospital. You got to push for yourself. And finally, as far as changing your schedule, I will tell you that, remember I said I have so many physicians that'll say to me, I ask everybody, when's your next vacation? They say, oh, I don't have one planned. Apparently, planning takes time. Doctors have decided I don't have time for that. I don't have time for anything. If you're telling me you don't have time for your life, no one's going to get you that time. You need to make the time to do the things that will make it better for you. If you don't plan a vacation, your vacation's not coming. You will always have more patients to see. So I think writing down your perfect day is incredibly helpful. I learned this 9 years ago. I wrote down what my day looks like from the time I wake up till the time I go to bed. And I wrote one for OR, one for clinic, and one for research day. The single thing they had in common was having breakfast with my daughter and husband. So guess what? It's been almost 9 years, and that's what we do. This morning, I got up at 5:45. We're at the table by 6:20. We all eat breakfast. I know there's just 3 of us. Then we all leave the house about the same time. I'm at the hospital by about 7, and sometimes earlier. But now I believe I can make my day better. If I write down what is it I want to do, take very small steps, make small changes. And whoever it is that asked me that, I wish for you experiencing your day different.
Dr. Wei, overwhelmingly positive comments. Thank you so much on behalf of my colleagues, on behalf of the 10,000 physician specialists of Quebec, for enhancing our well-being, for opening our eyes, for giving us tools. We owe you. I appreciate very much what you have done, and we wish you the best.